After the surgery, anesthesiologist will make sure that all pain is controlled adequately enough in the recovery room to be discharged. We usually give an infusion of pain medication that lasts many hours prior to discharge. In addition, you'll be given a prescription for a strong narcotic pain medication. This will be taken for the first several days. After several days after the surgery, non-steroidal anti-inflammatory medications will also be able to be added to this, and hopefully the narcotic medication can be weaned. Post-operatively, I send the patients home with a special wrap and special support to minimize post-operative swelling. Oftentimes, patients will go home with a drain. This will be removed at 48 hours in the office. After that time, we usually encourage well-supportive underwear, ice pack on and off, some elevation when sitting in line, and overall making wise decisions with regard to standing for long periods in real strenuous activity. The incision site is usually covered with a surgical glue post-operatively. The skin is usually closed with absorbable sutures below the skin. You can shower as normal once the dressing and drain have been removed. Usually with just soap and water and pat dry. Usually no special care is required for the incision. I usually have patients start pulling the pump down after the dressing and drain is removed around the first week after surgery if the patient's pain and swelling allow it. I usually encourage patients to get a combination stool softener laxative pill, commonly known as pericolase, which is Senate and Docusate. This, taken along with pain medication, can help relieve and prevent postoperative complications of constipation. We usually have patients sponge bathe until the dressing and drain has been removed in the office at 48 hours. After this, the patients can shower as normal. There'll be a little small site sometimes where the drain was placed that will seal on its own. We usually have patients wash with soap and water and pat dry. With respect to restrictions for activity, we generally recommend light activity for at least 1 to 2 weeks. Avoid heavy lifting, straining, standing for long periods of time. Patients are safe to drive after penile prosthesis placement once they're no longer taking narcotic pain medication. If they're not requiring narcotic pain medication, they're safe to drive. I usually tell patients to at least give themselves a couple of days until after potentially a drain and dressing would be removed in the office, and then they're usually able to resume driving. As far as returning to work, a lot of this depends on the job that the patient has, whether it's a desk job or a more active and physical role. Each patient is very different with respect to when they can return to work based on their level of activity. However, for most desk jobs and non-strenuous jobs, most of those patients can return to work in 1 to 2 weeks. More active jobs requiring great stress and activity, sometimes that can be closer to 2 to 4 weeks before they can return to work. Typical recovery is 4 to 6 weeks. You usually can use your device at about 4 weeks. The range of recovery as far as when pain is improved, when we begin cycling the device on a daily basis, those all have different steps leading up, but the overall recovery is 4 to 6 weeks. By 4 weeks, you should be using your device and return to work. Patients should call our office if they have opening of the incision, extreme swelling and bruising, intenseness of the scrotum. Patients should call the office if they have inabilities to urinate or they start to run fevers over 101. In the vast cases, patients' postoperative appointments are made. Occasionally, a card will be given to the patient for them to make an appointment the following day if the clinic is closed when the surgery is completed. Those appointments usually are made, though, by the recovery room. We usually make an appointment at about 2 days or 48 hours after the surgery to remove any dressings, drains, or catheters that's needed. After that, we usually have you follow up in the office in roughly 2 weeks. And at that time, we will see you along with the device rep who will help instruct on daily cycling of the device. This instructions provided along with demonstration. Patient usually then goes home and performs this daily cycling for roughly 2 weeks. At about 4 weeks post-operatively, the patient then is seen, and hopefully at this 4 or 6 week period, the device is cycling, pain has been adequately resolved, and at this point the patient is cleared to use their device. You should contact our office and leave a message. If you're unable to speak to someone, we will get back in touch with you regarding any post-operative questions you may have. If needed, we will allow you a visit in the clinic to be evaluated by one of the nurses or one of the mid-level providers if needed. If I'm potentially in the operating room or unavailable for simple questions that can be answered over the phone or online through the electronic medical record system.